I'm Nedra Knerp, President of Futura RGV, and I want to welcome Dr. Joseph B. McCormick and Dr. Susan Fisher-Hoch, and both of them are from the UTHealth of Houston School of Public Health on the Brownsville campus, and they have so many other interesting things to say about them, but our moderator, Felipe, is going to elaborate on that. And first, I would like to thank our Futura RGV sponsors who help bring these discussions to you. We appreciate them. And I do want to tell you that the discussion of these guests and those of other Valley leaders will be on the Futura RGV Facebook page, YouTube, and social media for further viewing. So please check them out. Now, our Futura RGV moderator, Felipe Salinas, will discuss with Dr. Joe and Dr. Sue Fisher-Hoch what we might expect with this pandemic. And now, Felipe, I'm going to turn this over to you and our guest to help us understand the COVID-19 challenges we face in the month ahead, and what we're doing right and wrong, and what to expect in the months ahead. So, Felipe.
Thank you, Nedra, and thank you, Dr. McCormick and Dr. Fisher-Hoch. Thank you for joining us today.
It's our pleasure.
Great. Well, just to elaborate a little bit, you know, some of your background, but I'll ask you to maybe fill in a few blanks just in getting to know you a few minutes ago before we started our actual interview. You all have you have traveled the world. You've worked in many, many different places in Asia, Europe, here in the United States, and in Asia. I'd already mentioned Asia.
Felipe, your audio is not coming through.
Sorry about that. Can you hear me any better now?
Yes.
Okay, sorry. Yeah, anyway, so you all are both medical doctors, physicians, and also specialists, virologists and epidemiologists. And I understand what brought you to the Valley nearly 20 years ago was to establish the School of Public Health campus in Brownsville with UTHealth Houston. But can you tell us briefly a little bit about what else attracted you to the area? I think people might want to understand what brought you here, because you had other options at the time.
Yes, we had decided after our years in Pakistan, we'd been out of the country for 8 years, 4 years at the Aga Khan University in Pakistan, and where we taught medical students and conducted a wide range of research. And then we went to France for 4 years, where Dr. Fisher-Hoch built the high security level 4 laboratory for the French, which she received the Légion d'honneur. And I worked at the Institut Pasteur and also for what is now Sanofi, helping to establish their epidemiology program. And this was their program on vaccines in Lyon, France. But we decided to return to the US for a number of reasons. We've been out of the country for 8 years. And but we decided to go someplace where what we do might actually matter to the community, instead of to a big medical center, which we could have also done because of our background with these. And it was at the time of a lot of bioterrorism concerns, anthrax, and all sorts of things. So there was a big emphasis on this. Nevertheless, we decided to come to Brownsville after interviewing in more than one place. And that was our choice. That's where we decided to come because it's bilingual, it's on the border, and it has a very international flavor, which is what we've spent much of our career doing.
And we liked it. We liked it when we visited. We thought this is a nice place to work and to live, and we certainly enjoyed the weather.
So that we started out now 20 years ago, just about 20 years ago.
And one of the reasons we're still here is that because there's still so many exciting things to do. And I just want to make a strong point that the people we work with down here, our teams, they're lovely people. We really enjoy working with them. And they're showing that even people with a limited educational background, they can be taught some really remarkable skills. We have got a team we're very proud of, and they're all
from the Valley.
All from the community, yeah.
That's
That
great, especially that you're instrumental in bringing such an important resource.
Felipe, can't hear you.
Oh, no. I'm going to switch and just go with the laptop. Is that any better?
Yes, that's
Yep,
good.
I can hear that fine.
I'm going to go with that. Hopefully that's going to work. At any rate, so thank you for bringing this important resource, the School of Public Health, to the Valley and helping to establish it. And I understand that your work over the last 20 years has also focused a lot on public health issues here in the Valley, such as diabetes and so forth. But as Nedra said at the beginning, we're going to focus on the pandemic, the coronavirus pandemic, and get your input on your perspective on what we've been through, what we see coming, and perhaps what we're learning from all of this. So let me begin by asking you to give us an idea on how you both have been involved in the Valley's response to the pandemic these past few months, in light of that background in epidemiology, virology, and public health. So how have you been engaged since all this started happening this past spring?
So we started back in March, really, when this first started to percolate, to meet with city officials, particularly the head of the Department of Health, the mayor, city commissioners, other people who asked for our advice, given our experience with viruses and our understanding of this. They asked for our advice, and we began to meet twice a week, and with our hospitals, I should mention. We began to meet twice a week. We still do. That started in April and late March and April. And we still meet with the CEOs of our two hospitals in Brownsville, with the mayor, the city commissioners, the EMS, the head of EMS, and a whole range of other people, as I said, including the CEOs of our two hospitals. And we have kept abreast of everything that's going on, both clinically as well as in the community. Secondly, we, as a School of Public Health and epidemiologists, worked with the city and the county, Cameron County, to help build a database so that we could track the epidemic in a proper way, and to try to understand what was happening in real time. And so that's been our activity. Plus, we have a whole range of research projects ongoing on COVID. We just received, with colleagues at Vanderbilt and University of North Carolina, a grant from Google to work with some of the people who are in one of our big programs. Our biggest program that we started 15 years ago is our Cameron County Hispanic cohort. Dr. Fisher-Hoch directs that, and I'll let her talk about what that's about and how it fits in with our work with COVID and our ongoing work.
Yes, so when we arrived here, we looked around and said, there's no Ebola and there's no Lassa, so what are we going to do? Better find out what's going on. And so to do that, we established a randomly selected cohort. Houses are selected by computer from the census, and we knock on the door and we ask them to participate. Well, we've now recruited just about 5,000 people from their houses. And we do it by having our team of local people from the same community. Because if either of us went to the door of a house, they wouldn't open it. They'd think we were ICE or something. But if you have somebody who clearly looks Hispanic, speaks Hispanic, and is culturally appropriate, then we knew that. We've been there, done that in other places. You've got to figure out what you can do and what you need somebody else to do. So they have recruited these people. We bring them into our clinical research unit, which is in space donated to us by the Valley Baptist Hospital in Brownsville. It's very nice. And we do a very, very, very thorough research workup. This is more than you would get going to your doctor for an annual checkup. This is pretty extensive, including imaging and other things. Anyway, to cut that long story short, we were in a position last March to know just how much diabetes, how much obesity, to at least one decimal point. So 27.6% of the adult population has diabetes already. And then there's a whole slew of people, another 32% who've got pre-diabetes. And half the population is obese, 10% are morbidly obese. So these are very big risk factors. So we said to ourselves, I think this is going to hit hard. Isn't that right, Joe?
That's right. And so that's some of the information. Now interestingly, we've published now over 300 papers, peer-reviewed papers over these 20 years from the campus. That's not all of us, but from our cohort alone, over 60 papers that describe in detail the health conditions from everything from depression to diabetes to obesity to cardiovascular disease, and even an extensive amount of work with cancer with MD Anderson on research. And so we were able to convey to the hospitals and our colleagues, the leaders of the city and the county, here are the underlying conditions that really are going to impact the morbidity and mortality from COVID. In other words, these people are going to be at high risk. And that has turned out to be the case. As you well know, the disease has hit really hard in Hidalgo County, all through the Rio Grande Valley. And so we were able to say to people right up front, this is what's going to happen because of the underlying conditions that we already knew and measured. And we don't just ask people, do you have diabetes? We do all the measurements required. We don't ask them we ask them if they have diabetes, but we do more than that. We ask them if they have heart disease, but we do a lot more than that to discover underlying conditions that people may not even know about. So that's kind of been the nature of our work, but it has helped us to have a clear picture of the risks on going into COVID. And the other thing that we've done, as I mentioned, is to help. And we have our faculty in Brownsville, but also highly specialized people in Houston at our main campus who do GIS mapping, for example, and spatial analysis, creating dashboards. And we have all of that information so that right now we're able to show our colleagues, the commissioners and other people, our health department in Brownsville and in Cameron County, exactly right down to the census tract, how much disease do we have? How many infections do we have in each of these areas? Where are the areas where the highest infection rates have occurred? Where should we be doing more testing? And where should we be doing more education to help educate people? So that's been our role in this process as well.
I think the first things we observed was when we first looked at the original maps to see who had tested positives. And you must both be familiar with the southmost area of Brownsville, which is the poorest and nearest the border, and definitely the most underprivileged people live down there. And there weren't any cases. And so we said, I don't believe it. I don't believe they're getting tested. And so the city said, oh, you're probably right. And so they went in there and conducted campaigns to get people tested. And indeed, that area is now been the hottest area for infections. And the hospitals keep telling us, it's funny, all our patients are coming from 78521.
Yeah.
And oh yes, that's southmost. So we were able, in fact, to give them heads up and say, are you getting to the right people? Are you giving people the right message? Because something else that we observed was the shift in the age group who are getting infected. And we questioned whether we were actually giving the right message to young people, that they're not eternal after all. They are, in fact, the vectors.
Yeah, I'm glad you mentioned that. It's interesting because I have seen some of the maps, the reports coming out of the Brownsville area in the last few months. And I was very impressed that it was telling you the neighborhoods where the counts were. So I guess we have you all and your team to thank for some of that, some of the
Yes, we've been supplying that information to both the city and the county. One of the interesting things that we observed, and we warned people about this, and I think I give credit to the mayor and the judge, mayor of Brownsville and the judge of Cameron County, who tried their best to keep the shelter in place that was started in April and went into about mid-May. And at that time, Cameron County had about 10 to 12 diagnosed cases per day. We had recommended early on, right at the end of March and early April, that they establish as soon as possible shelter in place and that they start do drive-through testing because we knew we needed to be able to track the virus. They did that. It was, in fact, Brownsville, one of the very first ones to have shelter in place. And so at the time that we went into May, we had about 10 to 12 cases per day. That's all.
Wow.
Once the governor and the state decided that now it's time to reopen the economy, and they started to do these phased reopenings, we said to everybody, this is going to be a disaster. And sure enough, you saw what happened in Texas. And we went from 10 to 12 cases per day to several hundred per day, 30 times more than what we saw during the shelter in place. So what happened clearly was the opposite of what everybody wanted. We opened the economy, but we also opened the door to the virus. And it is a virus that spreads really very easily in the air. You saw that our president understood that way back, but he decided he didn't want to talk about it. So, but we knew about it because we've studied these viruses. And so this is what we saw happen. And now we're in a quandary because if we've kind of gone back, we finally have masks and all that going on. But we were able to track this. And one of the first things, as Sue mentioned, that we saw was in the ramp up, the surge after reopening the economy, we saw a massive increase in the number of cases in young adults. And that's where we then said to the city and our School of Public Health worked with the city and the county to develop messages to go out and say, hey, you guys are going to the bars and the beaches and the restaurants, and you're spreading it to the older people.
And by the way, some of you can get very sick.
And some of you can get very sick as well, because we have plenty of young people with diabetes and obesity.
Somehow
Felipe, did we lose you?
we lost.
Yeah, I'm back. Sorry about
Getting
that.
back now.
Okay.
There you are.
Okay, welcome back, Felipe.
So yes.
Well, thank you. I know I missed part of that answer, but I'm sure that you were recapping, what happened when the economy began to reopen. Can you tell us anything about the situation right across the border? I understand you don't concentrate your research there, but is it about the same as in the Valley? If not, what's different? What have you heard?
It's anecdotal.
Yeah, we've heard many anecdotes, including some. So we have a staff member who works in Mexico on TB, and she lost a staff member there to COVID, a young woman actually, to
She's
COVID.
about 40, that's young.
Yeah, relative to us, that's young. 40 years old is not old. So anyway, it was a tragic situation, and it was difficult, we understood, for her to even get oxygen.
To get to a hospital.
And get to a hospital. So
and she died.
And so we've heard more about the kinds of situations there, to the point where people are having to pay like over $1,000 a day just to get a tank of oxygen.
Wow.
So but that's all anecdotal. We have no data from across the border.
We do know that people who were infected were crossing the border to get to hospitals in Brownsville.
Yeah.
And I believe that the Border Patrol were letting them through if they were sick. But that has slowed down a little bit now, so it may be that they also subsiding. But it does sound from a distance as though they had probably worse than we did on our side of the border. And Mexico in general has had has been hit very hard.
Yes.
So, you already touched on some of this, but you commented on the fact that the Valley was managing pretty well while there were local shelter-in-place orders through the early part of the spring and so forth, and then how it mushroomed after that when the economy opened up on a statewide basis. So, do you attribute the increase in the spread here mainly to that, or are there other factors that you think have contributed to the extent of the spread here in the Valley? Is it just businesses reopening, or are there other factors that we need to think about?
I think it's just movement and people and congregating and interacting. And we said it is spread by aerosol. And by aerosol, we really do mean, if you pass somebody who's smoking and you don't smoke, you get the smell quite away from them, and that they've just breathed that out. Now you're breathing out a virus and you can breathe it back in again. So the ease of spread was something that was very obvious to us. Even when the reports just came out of China, we looked at each other and said, it's spreading so rapidly, it's got to be aerosol. And so I think that means that once they opened up, it was out.
Yeah,
it was everywhere.
The opening up, people did not pay attention to a large degree to masks. They didn't pay attention to the social distancing. The restaurants and bars did not pay attention to the numbers. And we know this because one of the things we're very proud of, Dr. Art Rodriguez, who's the head of the city health department in Brownsville, is one of our graduates from our campus. Mm-hmm. And Art is, of course, a long time, he's a Valley person, and he's done a great job in managing this from the city point of view. And so Art has had inspectors out going to the bars and restaurants and checking on whether they were conforming to the guidelines, and they were trying to enforce this. But they saw that this was not being practiced as it should have been, and that's why we saw also this massive increase in the proportion. So during the shelter in place, the proportion of people, young adults from 18 to about 40, was less than 30%, it's about 25%. That shot up to 65% in terms of proportion of cases during the surge. And that's one of the first things that we were among the first to observe that anywhere. And we reported it. Steve Clark reported it in his article in the Herald. And so that generated messages to go out and say, hey, folks, you have tias and other people in your family who are vulnerable, who have underlying conditions. You're going to be taking this virus back to them.
So vulnerability is in fact what's considered an asset, the strong sense of family and community, and therefore a lot of gatherings. And once again, anecdotally, we heard of Easter parties and hurricane parties and these things going on because people are accustomed to really getting together very frequently. And I think the big problem that we have, certainly in our area, is the confusion about whose area is whose and who's giving the orders. And we got the judge, we've got the governor, we've got the mayors of different cities, and they're coming from different directions at certain times. So that's not very helpful. And then, of course, our real weakest point, our Achilles heel, is the island, South Padre Island, because that remains open with crowded beaches and crowded bars. So the people from anywhere, McAllen, Harlingen, Brownsville, they love to go to the beach and they have a party, then they want to go into Dirty Al's for the fish. And you know how crowded that is. You must have been there. So
we get reports from people that we know on the island who send us these reports, so we know this is what's happening.
Yeah. So your background in the Valley initially, part of you talked about the diabetes study that you started, that longitudinal group. So touching back on that, has our hospitalization and mortality rate been higher because of those underlying conditions? I mean, can you basically attribute that to that? Besides all these other factors for the spread of the disease, we also had we started from a place where we were poised for really serious outcomes on those two fronts.
Yes, it was interesting, Felipe, because you may be familiar with the strike force that the state has brought into not just Cameron County, but Hidalgo County,
Right.
Willacy, Webb County, a lot of, because of and what we got fed back by the CEOs of the hospitals was that the strike force people, when they came in, because they'd been to other areas, came in and said, wow, these are the sickest patients we've ever seen.
Yeah,
and we know that even today, the ICUs of the two hospitals in Brownsville are at near capacity.
Mm-hmm.
Now they've gotten better because they had to spread ICUs into other parts of the hospital. But if you take their standard ICU, it still is pretty much at capacity. And that means we're still seeing, and those are the people there, and about 2/3 of the people in the ICU are on ventilators.
Yeah.
And they stay on for
And they're people,
weeks sometimes.
yes, and they're people over the age of 50, almost all with underlying conditions.
Yeah. So what do you foresee for our situation here in the Valley over the next several months? What can we expect, and what should we be doing both at a community level and as individuals and households, especially as we try to get back to some kind of normal? I mean, what's your prognosis as you look ahead?
I just think that this virus spreads easily, folks. And when you go into a closed space, whether it's a schoolroom, a bar, a restaurant, a house, then that raises the risk of spread. The virus can go out if you're infected, even if you're not ill. If you talk, if you're not wearing a mask and you talk or you laugh or you sneeze or whatever, that projects virus out many feet beyond the 6 feet.
More than 6 feet.
More than the 6 feet that were originally projected.
And it'll hang around for about half an hour.
Yeah, and so that is the reality, and we can't change that except to wear masks. Try to have. I mean, we've advised many of the hospitals and others to, for example, to put in systems, these standalone air filter systems in the rooms where there was at risk. For example, a labor room. Think about a woman who comes in labor. She's breathing hard. She's, and so virus is going around and she can't wear a mask. So those kinds of situations have been where we have been trying to help with designing. So I'm afraid the future is that the more we try to open up and the less people follow the guidelines, we're going to see a surge again. And this is what people. Secondly, even though we don't see the kind of cold weather that other parts of the country see, nevertheless, the fall means people are back in schoolrooms and elsewhere. And I'm afraid we're going to see another surge. We got a report already of cases of dual infection of flu and COVID, and we don't know how much of that's going to happen. And these people are all quite sick. So I just think we must try to here stay home as much as possible, do as much from home as we can. But when we go out, we must follow the guidelines. Otherwise, we're going to see exactly what we saw around Memorial Day and after.
And if you do the math, it's pretty obvious. We estimate about 10, maybe 15% of the population have been infected. Okay, you can assume they're not going to get infected again, or you hope there won't be. That means you've got 85 to 90% of people who are still susceptible. So a lot of people can still get it. And, and until we have a vaccine universally in place for everybody, this is going to go on, unfortunately.
Yeah.
This is these viruses are very well adapted to surviving, and to moving themselves around and to replicating.
One of the things that we are going to see is more testing. We must see more testing. Yeah. Even now, as we get we still have over 100 cases a day in Cameron County, and you do in Hidalgo County.
This morning,
it was nearly 200 today. Mm-hmm. So we are not out of the woods, and we have to have more testing. once we get the cases down, we have to be able to test contacts. We're going to be getting testing demanded from hospital staff, clinic staff, businesses that want to know, do they have people who are infected? They're also going to want to know, are some of our people probably immune because of antibody? So that's got to expand as well.
Yeah.
And,
So what do you?
we were asked at one stage to help with contact tracing. Well, so each case may have 10 contacts, and all of a sudden you've got 100 contacts, 100 cases a day. That's 1,000 people you've got to contact.
You can't do it.
You can't do it. So that sort of basically collapses until you've got very small numbers. When you've got very small numbers, then you can follow them up and see where their contacts are. But right now, whatever we do has got to be at the population level.
So let me ask you, what do you think, or what do you hope that we've learned through this experience, especially from a public health and crisis management perspectives?
So I think, Felipe, that we were not even close to being prepared for this. Mm-hmm. At the local level, nor at the state level, and certainly not at the national level. The lack of leadership, the politicization of this stuff has been tragic, and you know, it's just the way it has been. And we didn't even have the wherewithal to gather the data that help guide the decisions about how to control, what to do, where to go. We had none of that. And I think it just points out that when you don't want to fund public health, you know, we all know Texas is way behind in terms of health funding in general. We were not prepared for this. We were not prepared to manage it. And we were not prepared to manage it clinically, and we were not prepared to manage it from the population level with the kind of tracking of data and messaging and all of the things that have to go into a serious effort. And so I think that has to change.
Yes, I think that the lack of preparation and the actual methods that we used really was exactly the same as we used for the Black Death. We haven't learned a thing. We haven't moved forward much. Until we get a vaccine in place, we're still identifying people who are sick, quarantining them. And in fact, the elimination of the Black Death only occurred when it was enforced by the military. If you left people to do it, they will evade you.
So I think there are some bright points here, though. Let me just point out the scientific community ability to develop the vaccines has been unprecedented. And I'm not surprised at that, because the progress at the molecular level in science has been so remarkable. We participate in that, so we know what it's been. And I think that is a real. The second thing is that I think that more emphasis on the partnership between the universities, our kinds of programs in public health, and the cities and the counties and the state must be strengthened, because that really is turning out to be a bright spot in this. And now I know our team in Houston has worked with us, but they also work with the Harris County. They've done a great job at also assembling data that they can then provide. And I know that our data is going on a regular basis to the city and the county, so that to help them make decisions. And I know that's also happening with Harris County and Judge Aguilar.
Northeast Texas.
And Northeast Texas. We've been working with Tyler as well in that area. So I think that's a bright spot. And if we focus on that in the future, we can actually build systems that can be put into place in our cities and our counties that are prepared then for managing this kind of a problem.
So if you have,
sorry.
Go ahead, Dr. Fisher.
I was going to say there's another side of this that most people are overlooking, and that's that this illness produced by the SARS-CoV-2 virus is sometimes prolonged. It can go on for quite a long time with a lot of fatigue and chills and illnesses. And we don't understand the long-term consequences.
The long-term
We're
effects.
also concerned that it may exacerbate diabetes, cardiovascular disease. The hospitals are saying, we're getting a lot of strokes, more than usual. And we wonder whether the coagulation problems that you get with this illness may in fact be precipitating other conditions that we're not recognizing. But so we're doing two areas of study here. One is the hospitals are collaborating with us so that we have their data, and we're going to do some modeling with the data to see what we can find. And the other is that we haven't put our cohort down at all. On the contrary, we've done about 11,000 phone calls to them since March to see how they were, to get any reports of illness, to give them any advice that they ask for. But particularly, we are documenting anybody who has COVID-like symptoms.
You're talking about the cohort in that study that you mentioned
Yes.
earlier, that longitudinal group? Okay.
So what we're doing now is we're getting ready to bring them back in. We've got to get our PPE and everything else so that we protect everybody. And we'll be able to do antibody studies and see just how many people actually were infected, who got symptoms and who didn't get symptoms. And then we can look at them and see if there are any long-term effects. And the advantage that we have, of course, is we have all these measurements in great detail before the outbreak.
Right.
So now we can go back and say, okay, what has changed? So those are the kinds of studies that we've got underway right now.
And that was the basis for the Google grant that we've just received with our colleagues.
Yeah.
So we're just doing it.
Yeah, you mentioned a while ago, Dr. McCormick, that maybe one bright spot has been the promise, hopefully, the greater collaboration between academic and health science centers with local and state government people to work more closely. So kind of this leads into that. If you had the year of legislators convening in Austin or in Washington at the start of the next legislative sessions or the next Congress, what would you most urge them to do, either in terms of continuing management of the crisis and in preparation for the next pandemic? Can you point to one or two areas that they ought to invest in or do something, either at the state or federal level, whatever you want to talk about?
So I've been a big proponent of investing in local local capacity, building local capacity. Way back in 2009, we had the H1N1 outbreak. I was at a meeting actually at that time with the director of the Centers for Disease Control, and they had put out this national program for managing flu outbreak. And I said to her, I said, this national plan is fine, but it's irrelevant to the local community because they don't have the resources that they could have to help manage it at the local level. And at that time, for example, oops, sorry about that. At that time, we were seeing, because we were on the border, if you remember, we had over 1,000 reports of suspected flu cases. And the CDC was reporting 60 confirmed cases in the country. And I pointed out to them that this is a complete disconnect because you give us the guidelines. So my point is, at that time, there was no local capacity for testing. When we started out with this epidemic, we were in the same situation. No local capacity for testing, no local capacity for gathering data on cases and tracking it, doing all the things that we already talked about. So my first, I would say to them, you must invest in local capacity if you want to control the condition. You cannot do it from Austin. You cannot have a laboratory big enough with 27 million people, whatever the population is now, that can absorb all of that. That means local, but that also means local jobs, local training. So that would make, and then working with the experts, the scientists, the clinicians who can help with managing this, working to set up a plan, a real plan that's not just some national, wishful thinking plan, but plans at the local level with resources to say, here's how we're going to do this. We're not over this epidemic, and I can assure you, given the population of nearly 8 billion people on the globe. We're nowhere near finishing. There are billions of viruses out there.
Maybe trillions.
And as we said in a book that we published many years ago on our work, we said in the world of viruses, we are the invaders. We are the ones going into their niches, and we're going to pay for it if we're not careful.
Yes,
Wow.
I think the lack of realism, because we worked for the CDC, so we were very proud to do that. But in the H1N1 outbreak in 2009, we got a call from the county health department basically saying help. And we went over there, and they had about 200 potential cases reported. And CDC had given them a 17-page questionnaire for each of, and they had 2 people to do it. I mean,
that's
the disconnect.
Yeah, absolutely.
So some bright spark at CDC said, oh, well, what a good idea. I'm going to have this questionnaire out and then I'll get all this nice data and I can write a paper. So out goes the questionnaire without realizing the impact on a small local health department, understaffed.
Got to be able to do those things. So I guess to kind of turn it back to a personal level as we wrap up, you know, what can you share, both of you, something that you've learned or been reminded of personally, I mean, on a personal level, as we've gone and continue to deal with the pandemic, especially here in the Valley? I mean, what has impressed you, or what have you either learned from this experience? I mean, you've had long careers all over the world. You've done all kinds of things, but is there anything that you have learned personally or that you've been reminded of that we need to try to take away with us?
For me, I've learned that the lack of leadership at the national and state level, serious leadership, has real consequences to our community and to the people who are coming into the hospital. The lack of action, never have I experienced. I mean, I investigated the early outbreaks of Ebola. I understood what was going on there, and I was very much involved in the 2014. But the lack of preparation and leadership at the national and state level that local people have no control over has nevertheless a huge impact on the families and the people in our community. And I say our community, been here for 20 years. And that is a profound lesson that we must not repeat.
Right.
I absolutely agree with that. It's been disastrous for us and has been responsible for the severity of the outbreaks. But I think I'd like to go back to relearning what I first learned in Africa, that if you work with people in a community, a low-income community in particular, how nice they are to work with and what a good job they can do if you put the tools into their hands. Those young people from Brownsville and from the county that we've had as students who are now out there really doing quite remarkably skilled things that are part of the response that we're able to provide to the cities and counties. So, you know, I think that the actual population and realizing that this is where we want to be working with people like that, not working in ivory towers.
The investment in those young people and in the people in the community for the future is what will pay off.
Right, right.
Yes, and we have the pleasure of working with a lot of young people, and that's what's keeping us going.
Well, great. Well, thank you so much for spending this time with us and really giving us some insight, you know, both from the perspective of what you are doing in Brownsville area in the community, but bringing all that expertise to bear in these last several months, but also pointing out to us what it could be if our leaders and our legislators were to invest in what needs to be invested in. So hopefully some of them you can grab some of their ear, and the rest of us will be better aware of what we need to advocate for as we go forward. Thank you all. Thank you both very much for spending this afternoon.
Thank you for inviting us. We appreciate it.
Nedra, you want to wrap it up?
Okay. I love and appreciate our valley because it is so welcoming to so many people like me and like you. And that makes people such as yourself come to our valley, which makes it even more special. And we're very, very grateful to have you and your expertise here in this time of phenomenal need. But I especially wanted to thank you for your comments about invest in our community, in local capacity, in local community leaders, in local resources. And that brings us jobs, that brings us training, and that stays in our community to make us stronger than ever. And that is such an important lesson. So you are a very important and valuable addition to our valley. And bienvenidos. We're
Thank you.
glad to have
Thank
you.
you very much.
Thank you.
Thank you.